Go. Well, many of you, very many of you, have been asking to have Kyle back on the channel. And so Kyle's thankfully agreed to come back. So Kyle, thank you very much for coming back after last time.
Yeah, I'm excited to talk, and I think it'll be fun, especially kind of filling in a little bit about the DC trip and how that went. And then also, I felt like there was a few things I saw in the comments last time that I didn't do the best job of clarifying. So yeah, I have a few things I just want to do a better job clarifying.
Fantastic, yeah. Fantastic. Let's just give a bit of brief background. So you had your first Pfizer dose in May. June 10th, you had your second Pfizer dose, and then a couple of weeks after that, you started to feel unwell. You had the fast heart rate. You had the fast heart rate when you were standing up, and you felt your heart wasn't right, and you lost your ability to do strenuous exercise because you are a professional athlete. You were a mountain bike champion. And the thing that particularly got me curious, as we've talked about before, was just a few seconds after you had your second vaccine, you had a metallic taste in your mouth. Now, to me, that is an indication that the vaccine went into a blood vessel, because it went to your tongue straight away within seconds. So we think that could have been part of the problem. You went to various healthcare providers, and eventually you were diagnosed with pericarditis, which is the inflammation of the layer around about the heart. Now, I think a million people, first of all, Kyle, want to know, how are you feeling now?
Yeah, I've actually been making some pretty good strides in the past few weeks, so I've been excited about that. I started seeing a new doctor who is like a brain and body doctor, and he's actually been helping me get through the POTS symptoms. So for people that maybe don't know, I got diagnosed with pericarditis, which, like you said, swelling of the liner around the heart. And then I also got diagnosed with POTS, which is called postural orthostatic tachycardia syndrome. Basically, what that means is your parasympathetic and your sympathetic nervous system aren't working in balance. And so like when I would go from laying to standing up, my body wouldn't regulate properly, and I would get kind of the blacking out, or just even if I was standing there, sometimes my heart rate would kind of run away from me. And another weird symptom was I would just start breaking out in sweat all the time, which is random. So I could be, my girlfriend gets mad at me because it'll be the same temperature every night when we go to bed, right? And then one night I'll be cold, one night I'll be sweating, one night, it's just hard to regulate temperature. And so this new doctor that I've been seeing, he's been working with me on neurotherapy, and then also some different supplements and peptides. And then we're doing hyperbaric chamber, and that's been helping me a lot. So I feel like my POTS symptoms are resolving a lot. And then now I'm just kind of trying to figure out my joint pain, which is like the reactive arthritis issues. And we actually did some cool testing in the past couple of weeks, and I got my Ige level checked with an allergist, and my Ige level is 883 and a normal one is below 115. So I'm having just a serious kind of reaction, and allergic reaction to everything. And so pretty much all the environmental factors we tested, I'm allergic to now, and then a lot of the food. So I'm just kind of playing this battle of trying to figure out how to calm down my joint pain.
I think that there's three things really to unpack there, Carl. The first is that when you stand up, you're aware that your heart rate goes up. This is this POTS thing. And can you feel your heart like beating away at a very fast rate, or what do you feel when you stand up?
And it's weird too, because I, for the most part, wear like a wearable tracker, like a Garmin watch, but I actually had to stop wearing it just because I was looking at it so much, like when you get into the situation. It's been 4 months of dealing with this. I stopped watching that, but you could just see it. Like I would go from laying down and have a heart rate of around 60, and then you stand up, heart rate's maybe around 90, and then it'll just slowly start running away up to like 130. And then if I sit down or lay down again, it'll come back down, and kind of just have to cycle. So I've been getting a lot better to the point now where I can stand quite a bit more. But yeah, like I was telling you right before we started this, we went out and tried to have dinner with a friend last night, and then just being out for like 3 hours talking and just trying to eat, then I kind of had a pretty bad relapse of symptoms last night and this morning. But I went and saw my allergist again, and we're just trying to figure out really like what I can eat now, because my body's so overreactive to everything. I could show you, we did an allergy test, and this is how it reacted on my back. I don't know if you can see that.
Wow, we can see that.
Yeah.
So let's say that again, Carl. They expose you to something, and
so they did an allergy test where basically this is all the environmental allergies. So like every tree and pollen and cat, dog, all these different things. So I've never been really allergic to anything. I've never had to take allergy shots or really anything. And then Now I just am like so hyper allergic, and we tested all the foods, and I'm like really allergic to peanut and beef and wheat and just a lot of the ones that are kind of inflammatory generally. I've gotten to the point where if I eat it, then my body just reacts. And so we've been doing a lot of research, and my allergist thinks I have something called mast cell activation syndrome. And so we're going to start some treatment and try to get the mast cells to calm down. I guess basically their role is to really just cause allergic reactions as a defense mechanism from eating toxic foods back in the day. But yeah, my eosinophils are really high, and then my IgE, like I said, is like through the roof. So yeah, other than that, I guess your question is if I'm doing better, but yeah, I'm learning a lot. And so I think that's what's been cool. And I think that's why a lot of people, in the last video, there's a lot of comments where people are going through similar situations, and a lot of them are having trouble getting diagnosed or knowing what to do. And so that's maybe why there was quite a few people that watched, just because a lot of people feel alone and not really sure what to do. And I'm kind of in this whole process learning as we go as well. And yeah,
I think it's a big part of the reason why we're doing this, Carl, because we want people that are suffering from things like this to know they're not alone. That help is available, and that groups are getting together to work out how to address these problems.
Yeah, so, and I think it was good to just like the last video. I think there's this conversation that needs to be had, right? And it's hard to have this conversation in a lot of places now, and that's what's nice about independent media and like YouTube. Sorry, I have a little dog with me.
Oh, dogs are great. Let's have a look at him.
It's a little dude. This is my girlfriend's dog.
It's fantastic.
Yeah. But I think a lot of people want to have this conversation and just hear kind of both sides. And, especially with your information about the aspiration issue, if it truly is as simple as just us changing the guideline around aspiration, then that could save a lot of people from being in this situation, I don't think it's that simple, but it's one factor, it's one variable that I'd really like to eliminate. Then we'll know. Until we eliminate that variable, we don't know. So you used to do these mountain bike events, Kyle. You're a mountain bike champion for three different years. How far were those events? How many miles? It was kind of different because the sport that I participated in is called enduro. And so what that is basically we will ride kind of a region. So say we go to like Colorado, we'll ride this one area like Crested Butte. And then basically what you'll do is you have 5 or 6 different stages, which are your race runs where you're timed down the hill, but you have to get to the top of every stage. So an average race would be between like 6 and 8 hours probably of pedaling. And then you'd have 5 or 6 timed downhill stages, which would cumulatively be like around 50 minutes sometimes. So it's kind of like a pretty full day usually. And then sometimes we'd even do multi-day races where it's 2 or 3 days back to back. So
this is physically 6 to 8 hours, really pretty serious, strenuous physical activity at an elite level.
Yeah,
is what
and
we're doing.
You're only timed on the downhills, which is like the sprint, but you still have to have the endurance to kind of do the full day.
You've got to get there. You can't take a lift up on a chairlift. You've got to cycle.
Yeah.
And what about now? How far can you cycle now?
I honestly haven't done anything since July when I kind of had my first big reaction with my heart. I'm kind of scared, to be honest with you. I'm scared to get back into it because I feel like anytime I start to push it or do anything, like I have a little rowing machine and I kind of worked up and was doing about 10 to 15 minutes a day on that. But then I can feel it, like even just right now, like I just have like a light burn in my heart. And so we did a stress test in September and my heart looked okay. The pericarditis was gone, but I'm still kind of dealing with the POT symptoms. And I'm not sure if working out and like causing this reaction again would cause the pericarditis to come back. So I don't know. I'm honestly just kind of nervous about what to do. I don't know what to do.
Which is completely understandable. I mean, all you can do is be guided by a cardiologist, isn't it? I mean, these people that specialize in this, but I understand that completely. You just don't
my
feel
cardiologist.
My
cardiologist had said basically, hey, your stress test looks good. And I think that you should start trying to work into things and see how it goes. And then hopefully by this winter, you'll be able to start kind of working out again. So that's really what I'm hoping for timeline wise. And, there's also been a lot of people that have reached out and said, even though this happened to you and it sucks that this happened, there are a lot of people that get the myo and pericarditis due to COVID as well. So like, I sympathize to everyone who has to deal with this regardless. And that's definitely not what, this whole story has been about, is like a woe is me type thing. It's more of just, like you said, trying to make people feel not so alone. And with those comments that we got, there's so many people that said, oh my God, I'm having the same struggles. And if I can kind of be a voice to help them feel like they know what to do a little bit. And yeah. And
no,
that was one thing that I did want to touch on too.
This is not an anti-vaccination video, is it? We're not saying don't get the vaccine. We're saying that this is a complication you've got from, we believe, from the vaccine. But as you said, rightly say, people get this complication from COVID as well.
Yeah.
And the suffering would be the same. Just tell us about this burn. You mentioned a burn in your heart there, Kyle. Just tell us what that is, where it is, and what it feels like.
Sorry.
That's good. It's good.
Yeah, so I guess the only way I can really describe it is just like almost like a fullness around my heart. So it doesn't feel like, when you get heartburn, it's kind of like acid reflux.
Yeah.
It's just more center of your body. This one's just more of just like a localized fullness and kind of just light burning that it comes and goes all the time. But like I said, last night when we went to dinner, when I got home, I really was struggling quite a bit with my joints. And then also just this morning when I woke up, I was like, man, my heart doesn't feel good again. So it was honestly, I had a pretty rough morning just because I'd been feeling like I was making so much good progress, and then got a little bit excited and tried to go out to dinner.
So you feel you kind of overdid it a bit last night, really, and that's kind of tired you out.
Yeah.
So what happens now if you eat peanuts?
I don't know. That's what I'm nervous about. But I did notice. So a lot of people were kind of saying, hey, you should try plant-based. You should try this. You should try carnivore. You should try all these different things to try to eliminate like the different elimination diets. And I did try that over the past few months. So I've tried everything from full plant-based vegan. I've tried, something kind of in the middle, and then even tried carnivore for a bit. But I noticed now if I eat any beef or really any sugar or wheat, then within about 2 to 3 hours, my body just kind of locks up and I just get really sore and tight. So I'm kind of in this position where I did a 4-day fast, like a 96-hour water fast. And that was really interesting because it was really difficult to get through not eating for a few days, right?
Oh, yeah.
But also all of my symptoms, like my immune symptoms and my reaction and my pot symptoms, all felt like they kind of faded away a little bit. So that was really cool. And I had 2 good days where I was like, oh my God, I think I fixed it. I'm better. And then, by the 3rd day, once I was kind of refeeding and started eating a little bit, then it all kind of came back. So,
and before this, you had no food allergies before this. This is all completely new.
Yeah. And that's why it's tough because, like you said, with the aspiration, hopefully that's, one huge factor of this, but it could also be something where I was allergic to an ingredient in the vaccine and maybe it caused this mast cell activation syndrome, or like, it's just so difficult to know exactly what's going on. And if it's, was this all caused due to the inadvertent intravenous administration, or was it caused maybe due to an allergy as well? And I guess that's kind of where this conversation needs to be had, right? Because for me, I was blind to the fact, like I honestly was blind to the fact that there was a big risk with this. I thought it was, it's been spoken about being so nonchalant, like do your part, get vaccinated. And that was kind of what we wanted to do. So I went ahead and got vaccinated. And then when I had all these issues, and then later on found out, oh, there is a risk of heart issue and there is a risk of these different things. And some people will say, oh, you're an idiot for not knowing that. But at the end of the day, I spent all of last year just trying to like work on our business and work on what we were doing. And I honestly just kind of wanted to do what was best for other people. So when they said, hey, you can't transmit COVID if you get vaccinated and you're going to need it to travel, and our job requires a lot of traveling, I was like, okay, well, that's 2 good things. Let's just go ahead and do it. They make it seem like it's no big deal. So I think that's why people are hungry for this conversation to be had. It's just acknowledging what's going on.
Let's just give a little bit of background here, Kyle. The IgG, the immunoglobulin type E, they're the ones that trigger off this allergic response. So it sounds like you're making immunoglobulin type E's to everyday substances. And in medicine, this is a condition we'll call atopy. So you've got essentially induced atopy that's making you allergic to all these things. And the mast cells, the reason that the mast cells are there in the tissues is actually to induce inflammation. So if I slap myself on the arm and my arm goes red, that's because the mast cells have released histamine. But inflammation normally, of course, is good. It's part of the healing process. But as we saw from that picture of your back, that's not good. That's remarkably bad. So your mast cells are releasing a substance called histamine, which is causing this allergic reaction. That's what's happening, and you never used to have that. And the eosinophils, or the white blood cells that we mentioned, they are also raised in allergic reactions. So they're raised in parasitic diseases, which you clearly haven't got, but they're also raised in allergic reactions, and people get them raised the eosinophils in asthma. So this is a classic, and I wasn't aware of this until we just started this conversation. This is very much an allergic pattern. But you also learned retrospectively that as well as having pericarditis, you had some markers in your blood called troponins,
Yeah, that was the other
which
thing.
indicate myocardial damage.
Yeah, a lot of people were curious. And the last one I had mentioned kind of being dismissed as an anxiety case or depression case, when I first went to the hospital. So a lot of people asked, what happened? What came of that? And so I do have the letter that they sent me from the hospital. And basically they said, thank you for submitting this report. And as you may be aware, the physicians who staff our emergency department are independent providers, not employees of St. Alphonsus. So that was their kind of response. And then that kicked me over to another letter. And these people said, they basically just said, we're sorry for what happened. It looks like you're ultimately diagnosed with pericarditis. That can be a very difficult diagnosis to make. It was not made at the ER. And, we're glad that you got treatment, and we're going to educate our group about these complications. So, that's really what came out of it. And a lot of people were saying, oh, you need to try to have that person fired, or just these different things. And I think
that's not what this is
we
about.
Have this. Yeah. No, it's not. And we have this fascination right now where if someone makes a mistake, it's like jump on them, right? And like this was a mistake that the provider made, and they're hopefully learning from it. And I just wanted to provide information for them to learn from it. But I don't want to live in a society where if you make one mistake, you're ostracized or, just kind of thrown out. And so that's how I felt about it. A lot of people are like, oh, you need to sue this person or sue the hospital. It's like, no, that's not what it's about. It's about let's have this conversation. Let's just learn about this and try to figure out what we can do moving forward to make things better, right? So I didn't want to show that.
The first diagnosis was pericarditis, and they say that's difficult to make. Well, I used to work on a coronary care unit. We made that diagnosis every day. It was a pretty straightforward diagnosis to make, to be quite honest. We didn't seem to have any difficulty with it at all. I mean, we would recognize it, would say, I think this patient's got a bit of pericarditis. Consultant would come around, yeah, he's got a bit of pericarditis. It would be a very simple thing. But I was very disappointed to hear that you had these raised troponins, which means your heart muscle was actually affected as well, Kyle.
Yeah.
So you had a degree of myocarditis as well as pericarditis.
I think a slight amount, because after our last talk, I actually did go and I pulled all of my medical records and got them for me to kind of review. And they actually had my troponin levels reported a bit differently. So it says the first troponin level they took, I was told it was, below a 1, but it was actually a 23. And then the second one.
That's a heck of a difference.
I know. And what's sad is that in my chart too, at the bottom, it basically said, high elevated level. People that are chronically sick or old may have a baseline near this. And so it's just like, I don't know what happened. And I don't know, a lot of people said, well, it's probably because you mentioned the word vaccine that they just automatically just shut you down and kind of said, oh, this guy's crazy. And that's what's frustrating about this whole thing is, I got vaccinated because I wanted to do my part and kind of help out, right? And so I'm obviously not anti. But then when you look at this and you say, how did they miss this diagnosis? And then there's also other markers, like my respiration rate was extremely high. I was in the ER for 3.5 hours. They told me I just have anxiety, and then, kind of kicked me to the curb, and I ended up in the hospital 4 days later again with even worse symptoms. So I don't know. I'm just grateful that there is platforms like this to just talk about this stuff in a kind of measured manner, right? And hopefully people can learn. If
the only message you get across, Kyle, is this: never ever assume a condition is psychological until you've eliminated the biological organic possibilities.
Yeah.
For a doctor to say that this is up here somewhere, it's a mental thing, where in actual fact there's a biological disease going on. It's just, don't do that. That just goes against every fundamental thing that I've taught for the last 30 years, to be quite honest. It's just, it's just incredible that would happen.
Yeah. And one thing that I did hear and kind of learn in Washington, D.C. this past week is that the NIH has pretty strict guidelines about even diagnosing things as vaccine injury right away. And so a lot of the doctors are afraid to make that diagnosis because they can kind of have it come back on them if they prematurely make that diagnosis. And so that was something that's kind of sad to see, is that there are a lot of doctors that are, oh, maybe this is happening in this direction, but I want to be careful not to put myself out there and put my neck on the line by diagnosing it as a vaccine injury. And I even had this past week a nurse privately message me from the hospital I'm being seen at and ask me, hey, I have a few patients that I think are injured from the vaccine. Do you know who I could put them towards? Like which doctors you're working with? Because I'm having a hard time finding treatment for them. And so there's like this small amount of brave doctors that are really taking this on as for what it is and saying, hey, I'm diagnosing this as a vaccine injury. I'm going to help you get treatment. I'm going to help you work through this. And that way you can at least even file a claim for like the CICP, which is, the payer of last resort for vaccine injury. Because right now, currently, if you submit a VAERS report, they never follow up with you. There's no follow up with that. There's nothing that comes of that. It's just you're kind of submitting out into the ether and hoping that you're a data point that they can use later down the road. But there is a program called the VICP, which is the Vaccine Injury Protection Program in the US. And the COVID-19 vaccines have immunity. As far as I understand, they have immunity from basically being a part of that fund. So the companies don't have to pay out the people that are injured. Then also you can't submit a VICP claim. But there is a payer of last resort called the CICP. And they've gotten about 3,000. The current number as of like yesterday was 3,022 claims of COVID-19 vaccine injury. And they have paid out 0 people so far. So they're all in processing. And some of the claims came as early as January of this year. So, almost 10, 11 months down the road, and we're still not seeing anyone get help. And I don't know what that is. And I'm hoping, it's nothing malicious. It could just be bureaucracy and how slow things are. But it is a problem that people aren't getting diagnosed with vaccine injury, which makes it not able to get support down the road. And I think that's one thing I just wanted to highlight as well is like, no matter what your stance is on this whole thing, we should all come to the realization and the agreement that we need to be transparent and we need to be forthright in the fact that people are being injured. And that way they can actually follow the correct path to get help. But when you have someone come in presenting classic symptoms of, pericarditis or something like this, or a heart issue, and then you dismiss them as an anxiety attack, not only does that kind of hurt their spirit and their soul, and it just makes me feel like I'm just this crazy person and then end up in the hospital 4 days later, but it also makes it harder to get proper treatment down the road. Because once you get diagnosed as an anxiety thing, it's hard to say, oh, no, I promise it wasn't. I actually was having an issue.
Yeah, it tends to stick. So we criticize doctors in China for being censored. We criticize the Chinese government that they didn't allow these doctors to talk about the pandemic. It sounds like what you're saying is in the US, doctors are being censored. That they are not free to express the concerns they want to they want to express.
Yeah, at least it puts them at a high risk. Like it could be, maybe they're not being fully censored, but it at least puts them at a high risk of having it come back on them. And
so it induces self-censorship then, really, doesn't it?
Yeah.
That is, if doctors can't give frank medical opinions, that concerns me quite a lot. I must say it does. Carl, you mentioned DC. This is District of Columbia, presumably. Washington. What's in? Is it the Capitol building?
Yeah. So we actually, last time we kind of chatted a little bit, but I got to go to Washington D.C. and be a part of this panel. And so there was around 20 people that spoke, and a senator named Senator Johnson organized the panel.
So this is testifying to Senate, isn't it?
Yeah, testifying to Senate. And Senator Johnson personally invited, Anthony Fauci, the head of the NIH, head of the CDC, the head of the FDA, the CEO of Pfizer, the CEO of Moderna, and all the state representatives of the vaccine injured that were speaking out. So like for me, that would be Idaho. And there was I think there was around 10 vaccine injured people speaking out, and then 10 doctors and scientists. And it was frustrating because, we were all very hopeful that we could maybe have a good conversation and hash this out a little bit. But yeah, none of the people invited showed up from that list. So that was
right. So Dr. Fauci didn't come.
Yeah, no one from the U.S. government that's in the CDC, FDA, NIH.
No one from the Food and Drug Administration came.
No one came, and they didn't even send a representative.
No one from Centers for Disease Control came.
No, 0.
No one from the National Institutes of Health came. No one from Pfizer came, and no one from Moderna came. And this is a hearing before the United States Senate.
Yes.
That is. I'm just going through that because it's hard to believe.
I know, and what's sad is I wouldn't believe it if I wasn't living it either. And I know, I've had so many people that are like, hey, it's not as big of a deal as you make it out to be, and this isn't really a thing that's happening. And I don't see these vaccine injuries happening, but if I wasn't living it, I wouldn't understand what's actually happening and how many people's lives are being affected. And, like one of the guys who spoke out, his name's Doug. He's also from Idaho, but he had a really severe reaction to the Johnson & Johnson vaccine, and it caused transverse myelitis, which is basically the demyelination of the spinal cord. And so what happened to him is his spinal cord ruptured, and now he's paralyzed. And he spent 30 days in the hospital, and the first 30 days in the hospital cost him $1.2 million. And there's no funding available right now for him or his family. So he was speaking out, on a much bigger stance than where I am. I'm just a guy who had a heart issue. But when I started to see this kind of unfold, I'm like, okay, well, I need to at least advocate for these people, because we all need to advocate for each other. We're all people in this pandemic and trying to make it through. And then when you see these injuries happen, which, yes, a lot of these injuries can happen with COVID as well, but a lot of the guys that are getting injured and the women that are getting injured, it's like, we've been told it's safe and effective. We're trying to do our part, and then this happens, and then where do you go from there? How do you get treatment? And yeah, it was just sad that no one even felt the need to show up or send a representative to listen to these stories. And it kind of showed me a lot. And the other thing that I thought was interesting is, Washington, D.C. as a whole has a very strict mask mandate everywhere you go. And so we were all at the hotel room, everyone gets down to the main lobby. Everyone has their masks on. We get on the bus. They load all the wheelchairs up because there's 4 people in wheelchairs. We go over to the Capitol. And as soon as we get to the Capitol, I realized that the security guard didn't have a mask on. And I was like, hey, this might be a super dumb question, but do we need to wear masks in here? And they go, no, anything in the Capitol and Senate building, there's no mask mandate. You can do whatever you want. So then we were there for 3.5 hours or 4 hours almost. And to just see the fact that all these people had no masks, they didn't even really social distance, they didn't do anything that we've been told to do. It just kind of opened my eyes even more. And then to see them not show up, and there was this table with all of their names, Fauci and NIH director, CDC director, all these people, empty table with their placards there with their names on it. And you're just like, okay, this is the problem that we're having right now, is that people aren't having honest conversation.
They didn't even send junior officials. No one at all. No one, zero
people. And the only news outlets that actually showed up and kind of reported on it were the independent news outlets, which are usually more conservative based, but there wasn't an NPR. There wasn't anyone there that wanted to just listen and say, hey, what's going on? It was just Newsmax and a few different Christian news channels, and that was it. And I don't know.
No CNN, no Fox, none of the big ones. I did listen to Doug's testimony, of course. I think it was just after you, wasn't he, Kyle?
Yeah.
I mean, so presumably he's bankrupt now then. I mean, who can afford $1.2 million? That's...
Yeah. And what's hard too is that, what we've learned through this whole process is there was 4 people that spoke out that have transverse myelitis. And so, I mean, even though, correlation does not equal causation, right? But if you start to see that there's these vaccines that all kind of operate on the spike protein mechanism, and then you're seeing that maybe it's all inadvertent administration too, intravenously, maybe that's what's happening as well. But you have all these different vaccines, and they're kind of manifesting in heart issues, and they're manifesting in this transverse myelitis problem, which 4 people had at this panel. You would think they would want to at least kind of investigate, and listen and say, hey, what is happening? Why is this happening? And try to learn a little bit more. So,
I mean, how easy would it be for any American research institution, any university, any decent hospital to find out everyone who was at that testimony, Senate hearing, for example, and just send them a questionnaire and say, did you get any immediate effects or metallic taste in your mouth? I mean, how hard would that be to do? It would just be so simple to do that. And people just don't seem to be taking it up at all.
Yeah, well, it puts you at risk too. So, everyone who is a scientist or doctor that spoke out, I mean, they are at risk of losing their job. So it shouldn't be that way. But the fact that they're just speaking out, because it says, trust the science. But if you're only looking at one side, and there is some data that was presented that was very, hey, we need to look into this. How do you just trust one side of something, especially if you're just not having an honest conversation? And that's kind of where my point of frustration comes. Because like I said before, I'm not an expert. I'm not a doctor. I'm not a scientist. I am a human being that's living through the situation. And I would have never thought in a million years that it was as real as it is, right? And then once it happens to you, it goes from being a rare situation to a real situation. And I don't know, it sucks. And I know a lot of people had issues with COVID, and I'm not trying to discount that either at all. But we do need to have this conversation, and it needs to happen. And people need to be present to listen and learn and just ask questions. I would have loved if someone like Fauci or one of those guys showed up and we could have an honest conversation. I don't know why that's so hard to ask,
Well, if any of these people are listening, they're more than welcome to come and talk to me. That's for sure.
Yeah,
no, I just find it so disrespectful that they just didn't bother to turn up. It's just, it adds insult to injury, doesn't it? It's just.
Yeah. And that's the hardest thing too, is there's a lot to learn from this panel. I mean, one of the girls, Calais, she had a really bad bout of COVID. And so what was scary for her, she thought she was going to die of COVID. and then she recovered. And then like a month later or so, she went and got vaccinated. And after her second shot of Pfizer, she had extreme neurological issues and tremors now, which have not resolved. It's been several months of just constant shaking. And what was really sad, John, is that 3 of the people that spoke that were injured at that meeting had been admitted to the hospital within 10 days prior for suicide. So 3 of the people speaking there were in the hospital within the last 10 days, suicidal. And then they're speaking here and the people don't even bother to show up. And so, like I said before, whether you're pro-vaccine or you're anti-vaccine or you're in the middle, like a lot of us are, we need to at least have this conversation. And it shouldn't be a taboo topic, right? It's like, yes, there is injury. Is it small? Yeah, probably. If it is advertent administration like intravenously, then why not change the guidelines? Why not have this conversation? The guy from the CDC, they could have been there and said, hey, you know what? Let's make sure. Did you guys get a metallic taste? You know, and I would have raised my hand. Okay, maybe we should look into the, changing the CDC guidelines, because it obviously states Moderna and Pfizer both say you must aspirate. And then the CDC says do not aspirate. So one of them is wrong, right?
Well, Pfizer and Moderna say it must be given intramuscularly. They don't say how, because they don't, they don't want to get into the clinical side of it, which I guess is understandable. But they do say it has to be given intramuscularly, and I don't think that's being ensured. That suicide bit hits pretty hard, actually, Carl. I mean, I've worked with quite a few people who've, suicide attempts and families of people who've committed suicide, and there's just nothing more devastating. It's just terrible that people get to that level of desperation.
Well, and it's sad too, because I mean, as a society, right, how could we prevent that? And one of the biggest ways we could prevent those people from feeling that way is by listening to them.
Sure. Simple human contact. This is what's so disturbing, that this is actually a conversation that doctors and scientists are not allowed to have. Mm-hmm. And I actually get this quite a bit. You know, I'll make a video which, like this, for example, people will say after this video, why are you pandering to anti-vaxxers? Why are you supporting anti-vaxxers? I'm not. I just want to get at the truth. Or you'll talk about a therapeutic and people say, why are you proposing a therapeutic and demeaning the vaccines? Or I'll talk about the vaccines and people say, why are you promoting vaccines? They're dangerous. No, we just want to get at the truth. It's a conversation that we have the right to be able to have.
Yeah, and one thing that I just kind of wrote down is, we do need to acknowledge the fact that there is a party in this situation that's making tens of billions of dollars from this situation. They're operating without immunity. They are also responsible for a lot of the scientific data and clinical trials being funded and pushed through. And they also sponsor a lot of the mainstream media narrative, right? And that's a fact. All of those are facts. And does that mean that they're doing something bad? It doesn't. It doesn't mean that. But it does mean that it could distort the view a little bit, right? And we need to have these conversations with people that are independent. And so I thought it was also interesting at that DC meeting, there was 2 people, Maddie, who is a 12-year-old in the clinical trial for Pfizer. She was dropped after her injury, and so she didn't count towards the data in that trial. And then Brienne, who's actually the one who organized the React 19 group, she was in the AstraZeneca clinical trial, and she had an adverse reaction after the first dose. But to complete the trial, you had to have both doses. So she counted as a withdrawal, even though she had a severe injury and was in the hospital for weeks, So just from those 2 people that I was with all week, I know that there's some distortion of data.
So Maddie's a 12-year-old girl. When she got a vaccine injury, she was taken out of the trial. Is that what she told you? Is that?
Yeah. So what happened with her is that she had the vaccine injury. She also had some form of transverse myelitis, and she has the paresis of the stomach as well. So now she's on a feeding tube of just liquid diet, and she's been in a wheelchair since I think March or February of 2021. And Pfizer's never been in contact with her family since she left the trial. But what happened is, on the app that they give you to track your test results, they basically give you a phone app, right? So you track your test results and your symptoms, and it's a multiple choice. And there's no place for an open forum. So the only kind of choice she had is like, okay, well, I guess stomach ache. So press that, and they're hoping that they would get a follow-up and kind of explain the symptoms more, why she's been hospitalized. And they never did a follow-up. So she is in the clinical trial data as a stomach ache when she's been in a wheelchair for the past year, and no one's ever reached out to her. So I don't know. It was eye-opening. Like I said, I did an Instagram post and I just said, man, my worldview was shaken quite a bit, because I'm always someone who I want to believe the best in people, and I want to believe that, they have our back and these people are representing us. And then just to watch the fact that none of them showed up, there's no mask mandate in the Capitol or Senate. No one's wearing masks, even though they're telling us to all do it. And then the fact that I know 2 people personally that were dropped from clinical trials as, basically non-results. And I don't know, it's just hard to, it makes me feel crazy too. That's what I've said so many times. I feel like if I wasn't living it, I wouldn't believe it. And I don't blame people for not believing what's going on, but like, I have nothing to gain from this and everything to lose, and all I'm trying to do is just kind of further the conversation like you, because at the end of the day, I want to know the truth as well. Like, if they're going to make it so we do have to do this annually, and there's going to be boosters, and it's just going to be constantly every 6 to 8 months or every year, you're going to be getting this mRNA shot, then we need to learn more about it. We should have these conversations. And at a certain point, the companies probably should have a little bit of money set aside in a fund to help people that do get injured, especially if it is 0.001%. Like, that's a pretty good return on investment for them, right? It's not like it's 10% of the people are getting injured. It's this small sliver, which you would think they would be able to set aside 0.5% of their revenue to help.
And it's not just that; it's the failure of your rep. I mean, the Food and Drug Administration, I thought it was there to ensure safe food and drugs. The Centers for Disease Control, I thought it was there to monitor diseases. The National Institutes of Health, I thought it was there to promote health.
Yeah.
Dr. Fauci, I thought, was there to take an interest in everyone's health on behalf of the president.
Yeah.
And Pfizer and Moderna, you would think, would want to have senior scientists there taking notes.
Yeah.
None of those were there. I just.
Yeah.
Yep.
Yeah, it's hard. It's a hard thing to be a part of, honestly.
It certainly is. And
I know from my own sanity, there's going to be a point where, like, even just this past week or two since we did our last talk, I mean, I feel like I'm kind of walking down the middle of the aisle and then just getting shot at from both sides. I had people message me and tell me I'm a terrible person and I'm killing tens of thousands of people by sharing my story and creating vaccine hesitancy. And then I've also had people tell me that I'm killing thousands of children by not being more aggressive and saying I'm fully anti, and it's like I've said this whole time, all I'm trying to do is advocate for conversation and acknowledgement that there's some issues happening so that we can have an honest discussion, right? Yeah. And like I said last time, if there's risk, there must be choice, I believe. Yes. And so, especially if you're a young, healthy person and maybe, you really feel like you could get through COVID, okay, and you want the more robust immunity of natural immunity, then like you should at least have the ability to make that choice. Or if you have had COVID and recovered, then why does that not count? Like there's a lot of things that don't make sense right now. And I guess I do think the vaccines are a great tool, like we said last time, but there's a lot that's not being talked about.
There is, and we need full data so that we can make informed decisions. At the moment, I think a big part of the problem is, I think the biggest the biggest contributor to vaccine hesitancy actually is that people feel they don't have full data.
Yeah.
So if there was complete openness and people had full data, then I think a lot more people would opt for the vaccine. So actually, by bringing these issues to light, I think we're actually promoting vaccination by encouraging people to share the full data, which at the moment it appears is not being done.
Yeah, I had a guy message me today, a college student, and he said that he had the first shot of AstraZeneca in Europe, and he got the first shot, and he's having some tachycardia issues, and he doesn't know what to do because his university is basically saying you must get fully vaccinated. So he's like, what should I do? Should I take the second shot? I can't really afford to go and get all my tests run. I don't know what to do. And it's like people like that. I mean, what do you do in that situation, right? It's like, do I have to figure out what to do to not go to this school? Do I need to change schools? They say, oh, well, you do have a choice. You could go to a different school that doesn't require you to be vaccinated, but is that a realistic option? And I mean, I don't know. It's just one thing my doctor told me early on, which I thought was interesting, is she said that, hey, you should have come in and done an antibody test before you got vaccinated. I was like, well, I didn't know that, because they're finding that sometimes people that had COVID and recovered, they have a strong antibody response already, then they fare a little bit worse from the vaccine. So
are we seriously going to do an antibody test on every single one of the millions of people that get vaccinated? Is anyone seriously saying that? It would be a good idea, but
yeah,
I can't see that happening in the United Kingdom, and I can't see it happening in the United States either.
Yeah.
On the last video, Carl, you got about 16,000 comments or 18,000 comments or something. Did you get a chance to read many of them?
Yeah, I did. I read a lot, and then I also had about just over the past 2 weeks, maybe around like 700 or so people reach out privately via Instagram and via our website and all that stuff.
Wow.
And
Wow.
yeah, I mean, it's overwhelming. That's why I said I know at a certain point for my own sanity, I'm going to need to step away. And I'm trying to just kind of
Sure.
further this conversation. We did a good
Sure.
podcast last week and with this guy, Aubrey Marcus, and he had a great analogy. And he said, like, the truth is like a beach ball that's being pressed underwater. And the more you speak and the more you share your truth and the more you have conversation, the more air you add to the beach ball, and makes it harder to suppress. So I guess, I'm just trying to add as much air as I can, but I'm pretty drained, honestly. And I don't know. It's just hard. It's hard getting
as an individual, you got to look after yourself. You can only do so much.
Yeah.
Especially when your health isn't tip top at the moment anyway. You got to pace it.
Yeah, it's tough, John. Like I said, I really just wanted to get the shot and try to do my part and help. And
sure.
And then this happened. It's been like 4 or 5 months of kind of just hell. And I don't know how to fix it. And I don't know how to talk about it without getting attacked. And then I have all these people, like, 10 to 15 people a day messaging me saying, hey, I'm going through the same thing. And I mean, you saw it in the comments of the last video. There's a lot of people saying, I feel alone. I'm going through the same thing. My doctor told me I have anxiety. I don't know what to do. And I mean, it's hard when you feel like crap and you're not doing well and there's no answers. And then you talk to someone about it and they call you a conspiracy theorist. It's like, what do I do? So, I mean, like I said, this isn't a woe is me type thing because I'm not the only one going through this. It's just this conversation needs to be had so we can all kind of empathize a little bit more with people that are hesitant or they want more.
You're not a woe is me type of guy, Kyle. That's for sure.
But I did also have a couple things I kind of wanted to touch on that I didn't do a good job of last time. And, I had mentioned taking ivermectin for a little bit in the last video. And so, I have some here my doctor gave me, but
what dose is it?
This one is, let's see, 18 milligrams.
18 milligrams. That's about right for you. Yeah.
So
how you got on with that?
People it helped me almost probably even more mentally than anything, just because after I got kind of the first diagnosis of, hey, this is anxiety, and then I really thought that I was having a serious issue and my heart did not feel good. I ended up going to the hospital a second time. Again, all right, we're going to get you into cardiologist. The soonest appointment is 2 weeks from now. Then I was like, what do I do for these 2 weeks? And so I listened to a podcast with Brett Weinstein and Dr. Pierre Corey.
Yeah.
And, after listening to that, I did take ivermectin for those 2 weeks in between, basically getting out of the hospital and then until I could see my cardiologist, because they were talking about how it could kind of maybe arrest some of the spike protein reaction. Because from what I understand from what they said, the molecule has a hole in it that's polarized opposite of spike, and it basically can attach to spike through a polarized attraction. So I did take that for a couple weeks, but once I got into my cardiologist, they put me on a course of colchicine. So that was what I was on for my pericarditis. So there was a little confusion where people said, oh, this guy tried to treat his heart disease with ivermectin, and that wasn't the case. It was just kind of like trying to buy my time until I could get in to see the cardiologist. And
did your doctor prescribe the ivermectin?
Yeah. So I had.
So it was medically prescribed. So you did the right thing. You went to your doctor and he prescribed the drug. Yeah.
So
and the colchicine's an anti-inflammatory thing, isn't it? It's used. I've actually remember using it before for gout. There's swelling people get in the toes and the knees, but it's also used in pericarditis, of course, and has that helped?
It did. I was on it for 45 days, but one of the side effects is like I started developing a bunch of mouth sores. And so that was kind of gnarly, almost like canker sores. Yeah. And then also I got very, very weak and fatigued, and I couldn't even really I would grab my girlfriend's hand and I was like, I'm squeezing as hard as I can. Does it feel like anything? She's like, no, you're like so weak. And so I was on it for 45 days until I got that cardiac MRI where they saw that the pericarditis had kind of resolved. And then I stopped taking that under the direction of my cardiologist. But that was just one thing I wanted to kind of touch on as that treatment that I did do. So.
And the other lesson to learn there is you've done exactly as we call them consultants in the UK, the senior doctors, the specialist doctors. You went to a cardiologist, you did what he told you. I mean, this is what we have to do, isn't it? Rather than just make things up for ourselves and take things on our own. And I'm delighted that you've only taken medication that your own doctor's prescribed, which is the correct thing. So, what else did the cardiologist say? Did he give you any intimation of what's likely to be happening over the next sort of weeks and months?
Well, just the last thing that I kind of had was when I got the POTS diagnosis, and they kind of told me it was going to be, I should expect to feel better within 12 to 18 months. That was the last thing that I had heard from them, and then he told me that there is a medication they could put me on, but it basically is I think it's called metropolol or metropol. But anyways, that one is supposed to help reduce.
Could be a beta blocker. I'm not sure.
Yeah, so he told me he could put me on that, but I was kind of hesitant to take anything, honestly. This whole experience has kind of made me a little bit nervous because I hadn't been in the doctor or hospital in years and years and years, and then now I've had over 20 hospital visits.
In your 20s, you don't, especially when you're an athlete like you. I mean, it's so you think it's 12 to 18 months.
That's what he thinks, but then when I started seeing the neuro doctor who does the brain and body stuff, and he kind of explained the whole parasympathetic, sympathetic nervous system issue, then I've been seeing a huge increase or a huge, benefit to that already with my POTS symptoms. Okay. And like I told you, I'm just kind of struggling now with the, what I thought was reactive arthritis, but it's kind of been found out to be this IgE, allergy reaction that I'm just constantly tied up in, because we got all my test results back with the rheumatoid arthritis markers, and those were normal, but then all the other things, the IgEs and the eosinophils are like the charts. So
yeah, you've got this massive inflammatory syndrome basically that is allergic in nature, and that's clearly affecting your joints. And joint pain is it can be really quite a bad pain. Is this pretty bad? This pain's pretty bad.
It's not fun. It's not fun. And I think the most frustrating thing is, like, if I don't eat for a few days, then I feel okay, but that's not sustainable, obviously, so it's like, I just am kind of just playing this balancing act of like, how do I eat the least amount possible, but then also get nutrients in, and then.
But that's not sustainable.
No, it's not sustainable. And so, like I said, I did that 96-hour fast, and that seemed to help quite a bit, but then it kind of just was really temporary as far as results go. And I don't know. We're going to start doing.
You're not exactly obese already, are you? I mean, you got too much reserve.
I don't have a ton. So yeah, I don't know. Yeah. I wish I had more answers, but I mean, all my doctors and everything basically just look at me and go, we don't have experience with this. We don't know what to do. We don't know what's going to help, but we're just going to kind of prescribe what we think will work. And so now I'm going to start some new medication with my allergist and basically do like H1 and H2 blockers, and then do sodium chloride, I guess, for the mast cells, and just kind of see what's going on. But I've also had a ton of people reach out since the last video we did, where they were talking, different naturopaths and healers and supplement doctors, and they had all kind of just told me different things I could try to do to help. And so I've just been trying to figure out different things I can do with diet and sleep and, filtered water and electrolytes, and just really trying to make sure everything else is perfect, right? And then let the drugs be a secondary thing, not just try to fix everything with drugs. So sure. I know a ton of people that have been messaging me. They're basically stuck on really high doses of prednisone to try to calm down.
You don't want to be on that long term, do you?
Yeah,
that's an anti-inflammatory steroid drug.
Yeah, and that's kind of the most common prescription right now for people that are dealing with vaccine adverse effect. So what I've been noticing a lot is people basically go in, they first get diagnosed with anxiety, they come in a second or third time and get followed up with an echocardiogram. And the echocardiogram is where they're finding a lot of the, pericarditis, because my EKG and my CKG and all the different things look normal, but until they did the echo, that's when they saw my pericarditis. So once they finally get diagnosed with that, then they start to treat all the symptoms, and usually you get on colchicine or metropol or whatever the heart rate reducer is. And then after that, they'll put you on.
I think it's a beta blocker, metropropanol or something like that. It's a beta blocker, I think. Yeah.
So that's kind of what the standard course of action is right now. Is just get in, finally get diagnosed, get on some heart medication, and then do the prednisone. But I've tried to stay away from prednisone because I know a lot of people that I've talked to, and my doctor was like, it's not fun to be on. So try to avoid it.
I mean, basically, any condition you'll probably feel better if you take steroids, but it's not a long-term answer. There's long-term side effects that you've got to be really careful about with steroids. Have you found any food you can eat, Kyle? Is there anything you can pig out on if you just need something? If you just need some stodge.
So far, kind of the only things, I just went and got a lot more stuff tested today, which we'll find out the blood results soon. But the only things that I'm fully not reacting to at all are eggs and milk, which are generally inflammatory foods. So it's kind of funny, but so I've just basically been doing eggs when I can. And then, just low histamine fruit and vegetables, if I can find that, like celery and things like that. And just trying to figure out, it's like a whole new life, honestly. And just trying to figure out, I don't know, it's just been so much learning this year, And
does the immunologist think that these allergies are going to gradually go away? I mean, what does he think, the allergy doctor?
They're not sure. I guess mast cell activation syndrome generally is something you deal with forever. That's what she told me today, is like, generally it's just something you manage. It's not something that fully goes away, but we haven't seen what the effects of, mRNA COVID-19 vaccines are, right? So it could be a few months down the road, things clear out and you're back to normal, or it could be this triggered like an autoimmune disease with you, and then now you're just going to have to battle this forever.
Well, I mean, let's hope not. I mean, she's probably talking about mast cell activation syndrome there that she's seen before.
Yeah, exactly.
The mast cell activation syndrome she's seen before has not been caused by COVID vaccines.
Exactly.
Because they didn't exist. This is new. So,
yeah.
So we I guess we just don't know. It's
yeah. So I'm a guinea pig for anyone else who has to deal with all this stuff. But it's sad when I get messages from people that are 1 or 2 months in, because 3 months was pretty dark for me. The first month, like, I literally transferred all my money into our joint savings account and basically told my girlfriend every night, like, love you. I don't, I was afraid that I was going to die of a blood clot or heart attack. And then after that first month, I made it through and I started to see some increasing gains, and that was better. And then now I'm kind of at a point where I feel pretty functional, but I just have to be careful of my energy load. But when I get messages from people that are, in the first month or two and they're really struggling, then I empathize so much, and it sucks just because I know what that's like. And
for a 29-year-old to have to live with the fact that he might be checking out overnight for a month, that he might be dying, is not a not a good month to have.
No, and when people jump on you for taking something like ivermectin or something like that, right? And you're like, dude, there's no approved treatment right now. And the flccc.com, they have that protocol on their website, right? And I showed my doctor that protocol where they do like the ivermectin, they do fluvoxamine, and they do a statin, and then one other protease inhibitor, I believe. And they have like the 4-drug cocktail. And I showed that to my doctor, and she just told me, nope, like I cannot prescribe that for you. And so my naturopath, my friend who's a doctor, is a naturopath, she was able to get me ivermectin, but it's like, everything else is just like, oh my God, why is this so difficult to try to get help? And then when you feel like you're going to die and you're just so desperate, then
you just want to try something, and that's often what you do. You try something as long as it's acceptably safe, and then just see if it works.
But I don't know. I mean, it's hard too, because like I've said many times, I know that all of this stuff could have happened from COVID, right? Like a lot of these symptoms and these issues. So for whatever reason, whatever mechanism is happening in COVID, whether it's the spike protein or what's happening with this vaccine, like if it is inadvertent administration and then you get the spike in your bloodstream and then that's what causes this, then we need to know that. We need to start studying it and learning it, because it just doesn't make sense to just let people be high and dry and just kind of close your eyes and say, all right, well, just keep taking boosters and it'll all work out. Just keep doing,
I understand that entirely. I think, for people like you to come on, forums like this, Carl, and describe the suffering you've gone through, I just think it's a real self-sacrifice that you've done this. And as I speak, I mean, there's millions of people, or who knows, another million people, if the same number as watched the first one, sort of nodding along in agreement. That they, I just want to express my appreciation on their behalf, because it's a great thing that you've done. Yeah,
thank you. It's hard being the sacrificial lamb, but this conversation needs to happen.
So anything else we need to talk about on this one, Carl? I mean, I'm hoping you're going to come back and give us an update at some point. If you would like to.
I hope the next update I'll be riding my bike and we can do it from.
So do I. Yeah. We could do a GoPro video of you cycling up a hill. That would be great.
I don't know. I think we kind of touched on everything. For a lot of people were wondering why I had mentioned, potential spike causing this issue so many months down the road. And I was just going to say that if you are curious about that, people should look up Dr. Bruce Patterson. He has a good series about spike protein and non-classical monocyte reactions that they're kind of finding out. So that might be a good thing for people to look into, just that are curious. And then, I think that
the first link we'll put underneath, Carl, we'll put the link to your websites, obviously. And then we'll put the link to the Senate hearing, because that's, if you can bear to watch it, that is powerful. Not an easy watch, but pretty powerful. And I might just edit a short clip of your particular deputation to Senate and put that on the end of another video sometime. And then
Yeah.
I don't know Bruce Patterson, but we'll find a link from him and put that on. And anything else you'd like to sort of
I did have a
put links
question
for?
for you, and
Mm,
just a question I wanted to ask, because I saw a lot of people asking in the comments last time what you meant by herd immunity. And
mm.
that was a question that I had, because you had said that, vaccines, we need to have the vaccines to work towards herd immunity. And I just, like I said, I'm not a doctor, I'm not a scientist. I just kind of want to know
Sure,
what you
yeah,
mean by
sure.
that, because
Yeah,
it
sure.
seems like a lot of the people that were speaking out this past week were saying that due to this being an RNA virus versus an adenovirus, it's the flu, like we've never eliminated the flu, but then we're trying to eliminate coronavirus. But I don't know if that's, or herd immunity means something different. And I'm not,
Mm.
you know.
I mean, it's herd immunity or community immunity. So at the start of this pandemic, we thought, well, once 70 people actually get exposed to this and they have antibodies and they're resistant to it, then if anyone does get the virus and they're infectious, the person that they bump into, there's going to be a good chance that they actually have immunity to it because they've already been exposed to it. Therefore, they won't get the virus. Therefore, they won't pass it on. So eventually, any infected person is going to be surrounded by like a firewall of immune people. And we were hoping that once about 70% of the population got immunity, then the numbers would start to go down. And then the Delta variant came along. Well, first the Alpha variant, then the Delta variant. And that number went up to 80%. And now that number is probably nearer 90%. So we need an
Okay.
awful lot of people to be immune. Now, there's two ways that people can become immune. One is the natural infection, and the other is the vaccination. And so if enough people become infected and enough people get vaccinated, then you get a lot of people with herd immunity. Anyone who does get infected is likely not to spread it on because people around them are going to be immune. And you would hope from that the numbers would dwindle down. Now, this is what's typically happening with lots of other diseases. Trouble is, so far with COVID, it doesn't seem to be working. And it's not entirely clear why it's not working. Now, with influenza, the reason it doesn't work is that virus mutates so quickly. The influenza virus mutates a lot more quickly than the COVID-19 virus. But the COVID-19 virus, of course, is still mutating, and there's a few thousand versions of it now. It's just that the Delta variant has outcompeted them all. But we're still hoping for this herd immunity. Now, that doesn't mean that this disease won't be endemic for a few years. For quite a long time into the future. When I say a few years, it could be 2, 5, 10, 20 years. This virus is still going to be circulating about. My hope is that it won't be, because SARS coronavirus type 1 was actually eliminated. And we don't have endemic forms of the Middle East respiratory syndrome, which is the other form of coronavirus that causes disease. Still a few cases of that every year, but that tends to come from camels. Mostly in Arabia. So long term, be hopeful we could, if not eliminate it, that so many people would be so immune that if you did get it, it would just be a minor inconvenience or you'd be asymptomatic. But I don't think we've got a very satisfactory epidemiological explanation at the moment for why herd immunity has not kicked in much more than we would expect it to. So it is an open question for the epidemiologists to sort of get back to us on that one, but it's disappointing so far, but we still hope for it.
Yeah, that's interesting. I know it's crazy that I think everyone just wants to get through this whole situation. I don't even know, I don't know what that looks like. And like we said, the vaccines could be a great tool in that whole situation. And I hope that we are able to have this conversation and open it up. And then people that are afraid or they're at risk of complications like what I had, or if we can figure out what makes people at risk, if it is like a blood type issue or if it is a pre-existing underlying condition. A lot of people said, oh, well, we don't know your medical history. So it's you probably knew that this was going to happen if you would have gotten tested. It's like, I don't know that that's the case, especially if it was an inadvertent intravenous injection, then who knows?
But I will be certainly reluctant to give you another one, that's for sure.
Yeah, I think I maybe told you last time, but I asked my doctor if she could file an exemption for me for the booster, and she said it's going to be really difficult. And I was like, what? And if
it's difficult for you, it's impossible for anyone else then.
Yeah, so she told me that she was going to try to at least, do a religious exemption if she can. But I guess my issues that I went through so far from what she's seen are not considered bad enough to be granted an exemption from the booster. So if they change the new vaccination status, there could be a chance that I would be no longer vaccinated. And then therefore I'd just be like this kind of I don't know, broken toy on the side, you know, just like.
So no longer being able to do your job is not a sufficient reason. That's not a good enough reason. That is
Yeah.
pathetic.
And
You know,
having, you know,
I like your military analogy, Carl. You know, I think you said this in the last video. We don't leave our soldiers behind. You know, if someone's injured in battle, we don't say, "Oh, well, good luck, mate, I'm off."
yeah.
You sacrifice your life sometimes to help your fallen comrades, and
Yeah.
and that's that you know, there's men and women who have fallen in this battle, and we need to do everything we can to pick them up and take them with us, not say, "Oh, you're collateral damage, don't care."
Yeah.
You know, that
Yeah.
is.
And I'm, like I said, I'm one of the very lucky ones who did have an adverse reaction and will probably make a full recovery, I'm hoping, at some point. You know, it might take some time, but I think I'll be okay. Like, I'm pretty functional. But just to watch, you know, like you said, if you watch that conference and you look at the stories of like Maddie and Doug and just these different people and Ernest, like, you know, a lot of the people that are going through this and they're having this life-altering circumstance, they're not so lucky to be able to just get through it and kind of move on. And that's why, you know, a lot of people say, hey, you need to stop speaking out. You need to stop sharing your story because you're creating vaccine hesitancy. But like you said, I'm a person that, like, if both sides are presented, you know, let me hear both. And I want to just try to make my step. But when it's so censored to one narrative and one side, it makes you feel like you're being misled, right? And I just think
that's what's causing a lot of this, what we can only call paranoia.
Yeah, for sure. For sure.
Yeah.
Well, thank you for having me on again.
No, Carl, thank you. I'm just so well, it's humbling, but still strangely interesting. It's a strange, frightening. It's a strange combination of emotions, really. Just listening to you, it's
well, that's how I feel too. I don't know what to do, and especially with, you know, with the vaccines waning, then if I am no longer protected at a certain point, and then it's like, then do I have to go through booster or do I get COVID again? So that's why I got, you know, more of this stuff to try to help. If I do get sick now that I'm immunocompromised, then
I mean, has your doctor tested to see if you did have the natural infection? Has he tested for the naturally occurring antibodies?
They've never done an antibody test on me.
I wonder why not. I mean, that is well worth asking for, isn't it?
Yeah.
Because if you've got just antibodies to the spike protein, that means you've just got those from the vaccine. But if you've got antibodies to the membrane protein and the different proteins in the virus, that means you've had the natural infection.
Yeah, I'll try to fight for that a little bit more. I remember asking for it early on, but they're like, "Oh, it's no point because we know you're vaccinated." And I was like, I don't know. Basically,
there's every point, because we need to know that to help millions of other people.
Yeah. So I'll ask for that a little bit more. And then if anyone else has any other good questions or things that I need to clarify, again, you know, if you throw them in the comment section below. I read a lot of the comments, and like I said, I tried to clarify those few things, especially about the ivermectin. I didn't use it to try to treat my pericarditis. I tried to use it just as a crutch because I didn't know what was happening. And then
got it. Yeah. And we appreciate the time you've put into to answering comments and to answering all the hundreds of emails you've had, Kyle. You are providing a real
the React 19
motivation
website,
to people.
Ever since we did our video, the React 19 website, they've been averaging about 700 emails a day. So
it just shows you how much concern and problem there is out there. Yeah,
you're doing a good thing by having us talk about it.
Yeah, absolutely. We'd love to have your report back whenever you feel it's appropriate. We'll there'll be people wondering how you're getting on, that is for sure. So Kyle, thank you very much, and hopefully we'll talk again soon.
Yeah,
with good news next time.
Yeah, hopefully on a mountain bike next time.
Oh yes, absolutely. I want that video.
Yeah.
Thanks Kyle. Thanks.